Jessica Richmond, a psychotherapist from the United States, here in India working with Dr. Chauhan of the Jiva Institute. Dr. Chauhan is an Ayurvedic doctor with over 20 years of experience working with both Indians and Westerners with a specialty on Ayurveda and the mind. Welcome to our show. Namaste, Dr. Chauhan.
Namaste, and I'm very happy to talk about this subject. So what's your question?
As an Ayurvedic doctor for the past 26 years, what's the most common ailment that you treat in Westerners?
I think when I look at the Western mind or the Western people, I see that mind is the biggest problem there. I have been traveling all over the world for last 20 years, and it's a lot of difference. When I practice in India, it's very different. When I practice in the West, it's very different, because in the West, people have all the materialistic things. They have nice houses, cars, and very clean. Everything is very organized. But interesting thing I find is that majority of people are not happy. As compared to when I come back to India, I see people are poor, they have no houses, they have no money, but they are very happy. So I worked on this for many years, and I understood the reason is that in the West, the mind is not healthy, not happy, and people have a lot of emotional problems. People have a lot of, what we call like experiences stored in their subconscious mind, which are continuously, surfacing and, creating some kind of so-called mental diseases in them, like bipolar disease or, ADD or anxiety disorder, many types of diseases. But what I have found out that there are problems in the West, like loneliness is one big problem, relations are a problem, and in one line, if I would say, it's just lack of love. There's no real love in the relations, and that's why the life of people is very empty. They have everything, but still it's empty. So this is what I have experienced in the West, and I think Ayurveda can play a very big role to help these people, and I have been working to help many people through Ayurveda.
So how would you define what is love?
Well, it's very simple. A lot of people think love means like physically, meeting each other, or that's what people say, making love. But that's a small part of it. The love is when you want to make someone happy and you don't want anything back. Giving without any expectation is love. It's little hard in this world to practice this, because we have not been trained to do this. But I believe that this is the real remedy. If we want to enjoy our life, if we want to be successful, if you want to do anything in your life, love has to be there in relations, in workplace, in wherever you go. You have to have that relation of love. Otherwise, you always have that formal relation or connection, which is not really very fulfilling. It's not very satisfying.
What are some themes that you've noticed about the mental health of Westerners?
I think in the West, when I notice the people, as I said, they have all the materialistic, facilities and luxuries, but they're not happy in the mind, and the diseases are described. They are given some names. It's very interesting that when I see people called like bipolar disease or schizophrenia or all these so-called difficult names, but we don't go to the root. The root is somewhere else. It's not just the brain, the chemicals in the brain, and that's what we're trying to fix with medicines. So what I see in the West, the main thing is, again, that people have to understand how to relax the mind, how to keep the mind more peaceful, how to understand the mind, functioning of mind, and how the mind operates on our day-to-day basis. These are the kind of things we need to understand about mind. And I would say that in the West, majority of people are suffering at mental level, and in India now this thing is coming also. More recently, I am finding as India is growing economically, I always say the Sensex What is that? The share market is going up, but the health share market is going down, and especially a lot of mental problems are coming. Because I believe that we have to find a complete balance in our life, material balance and spiritual balance and mental balance. That's what Ayurveda talks about. Ayurveda, if you analyze the word Ayurveda, Ayur means mind, body, senses and soul. Veda means knowledge. So this is a knowledge about body, about mind, about senses, about soul. Very important knowledge. Everybody should know it. We all must know, because this is knowledge about me. If I don't know myself, then I definitely will make some mistakes. I will do some, kind of things that will create an imbalance at some level, and that's what is called a disorder or a disease. Whether it is at physical level, or is it mental level, or even spiritual level. Spiritual level is also something in the West people don't understand. Many people, when I talk about soul, they become very scared. They think this is some religion. No, soul is that energy in all of us which keeps us alive. So that spark, that energy, that whatever you call electricity, that's a part of me. Rather, it's me, and I must understand it. I must know, who am I? What is this energy? How do I keep this energy in a state of healthy state, or in a state of what we call contentment? That should be feeling always, because sometimes I meet people who are mentally healthy, physically they are healthy, at every level relations are good, profession is good, business is fine, but they tell me when they come, what, I feel something is missing in my life. I feel like I want something more. So that's the level of the soul when some people do feel it after having achieved all those so-called material pleasures and mental satisfactions. So we have to also consider that part, which is totally missing in the West. And I think, if I always say, if the West can understand the soul, then the Western countries are like the best examples how we should live in this world, because materialistically they already have everything. What they are missing is actually the soul.
So how would you relate depression to the soul?
Well, depression is definitely a mental disease. So you can't relate this with soul. Soul never gets sick. This is the interesting thing, Soul never gets sick. Soul is always healthy. Soul is, we say, it's eternal energy. It doesn't get old. It's beautiful, young, eternal, not sick. So if we can really get to that level, then all problems are solved. But talking about depression is a mental disorder. I mean, it's the state of mind. And very interestingly, it's the state of mind due to some external situation. I have experienced this, and I deal with so many depression patients. They come to me. It's a very common problem now all over the world. But the first thing I tell them, that you have no problem. So it sounds very, interesting maybe for the Western psychotherapists or Western doctors, because in the West I know a lot of psychiatrists. They are good friends of mine, and they tell me that when people come to us, the first thing we tell them that you are depressed and you need medicines. But in our approach in Ayurveda, that's what I do. I try to motivate them to understand why they are depressed. There must be something, maybe financial problem, relation problem, or health issues, or any other external. Sometimes the weather can cause depression. A traffic jam can cause a depression, because you have to reach somewhere and you are stuck in a traffic jam. So your mind, it's a state of mind, and the state of mind can be changed. It is not permanent state of mind. It's a temporary state of mind. But most people do not know how to change that state of mind. And then we end up taking only medicines, which make us feel good. That's fine, but it doesn't solve the problem. The cause is still there. So we have to also understand what is the cause of my depression.
So you said that most people don't know how to change that state of mind.
Yeah.
Could you talk a little bit about how to change it?
Yeah, it's because in order to change the state of the mind, you have to understand what are the states of mind. There is a healthy state of mind, which is called the relaxed state of mind, the peaceful state of mind. And I don't know, most people don't realize everybody wants to be happy, but we don't know what happiness means. Happiness is just a state of mind also. Whenever our mind is relaxed, peaceful, that means there is no desire in the mind, we are happy. Now, many people, think that, when they buy something, they buy a new car, they buy a new house, or they get a new dress, or they find something which they were desiring for a long time, so they feel happy. So they think that that particular thing is giving them happiness. No, it's not that thing. It's the relaxed state of mind. Is the state of mind when you now have no more desires. That's the state of happiness. So this is what people have to be taught. They have to be, made to experience this. And then the other states of mind, what we are in Ayurveda we say, is one is the agitated state of mind, when your mind is disturbed and it's continuously, desiring things and hankering for, material pleasures or things. In that state, nobody is happy, because you are wanting more. You achieve one thing, then you want something else. So that is also the cause of our unhappiness. And then there is another state of mind, which is very, like inert state of mind, very dull state of mind, where you can't even think properly. There are many people, like people taking drugs, and some people who are completely in that state of mind. The mind is closed completely. So these are the three states of mind described in Ayurveda. And our goal when we approach to any mental disorder, or when we are treating any mental disorder patients, our goal is to bring them to this relaxed state of mind. That's why you will understand that why yoga and these breathing exercises and meditation, they are helping people so much. It's nothing. They're just trying to relax the mind, because a relaxed mind means less agitation, less desires, will make you happy. And that's what everybody wants. We all want to be happy.
A potential hazard of being a psychotherapist is burnout or compassion fatigue. How would you work with a psychotherapist who's facing burnout?
This is a very interesting question, and many people ask me this question. Even not only just psychotherapists, but even healers, doctors, and often they complain that when people come to us with all these negative emotions and negative energies, we get affected by this. Now, this is a simple situation which we have to understand. If my immunity is weak, whether it is physical immunity, so I'll catch some infection from outside, or some virus can attack me. Similarly, at the mind level, if my mind is weak, again, so then I can be affected by some other person's mental state. At mental level, we also have so-called infections we can catch from other people. So the main thing is that the psychotherapist or the mental healer, first of all, he himself or she herself has to develop that state of mind, that immunity at the mental level, that whatever situation around or whatever difficult cases they hear, they won't be affected by this. It's possible through Ayurveda. In Ayurveda, we have a lot of programs, including like daily routine programs and some simple, breathing exercises, some small meditation program. I have actually created a program called Jivananda, and it's a Sanskrit word. Jiva means we as souls, and Ananda means bliss. So how to attain that eternal bliss through a simple program? It's possible for psychotherapists and for everybody. We all should learn this technique to increase our mental immunity, so that we can protect ourselves from the so-called compassion fatigue.
Okay. Can you talk just a little bit about one of the daily routines that you've seen that's very effective?
See, the daily routine, it's not something very complicated. We have to understand that this whole system works in a rhythm. If you look at the heart beats like 72 times per minute. The lungs expand and contract 20 times or 18 times per minute. The peristalsis movement, everything in this system is a rhythm. When we don't follow a rhythm or a routine in our daily life, then we are not in harmony. So we get out of rhythm, and then we have all these so-called problems. At the mind level also, mind has a rhythm at which it works very nice, and it works in a state of what we call that the strength is good, mind is healthy. The moment that rhythm is broken, so we get so many mental disorders. So the program that I have created is just to bring people back into their original rhythm, their natural rhythm. It's not very complicated. It's all about how you should sleep, when you should sleep, when you should wake up, how much time you need for your body to little bit exercise, or which parts of the body you should exercise, how to relax the mind, and finally how to understand the real goal of life, which we all should, that who am I, where do I come from, why I am here, why I am having all these problems, and how can I solve these problems, and how can I be without problems. It's possible in this human life. We have to give priority to this very question. We have so many priorities in our life. Always we are wanting to achieve things and gain more and more, and attain more material things, but we miss the small thing which will solve all the problems, that I should find out more and more about myself, my physical body, my mind, my subtle mind or subconscious mind, my intellect, my ego. These are the subjects of Ayurveda. Very nice. This is how Ayurveda explains a human being, and explains at every level how small things they can create this so-called out of balance, or they can create arrhythmia, like arrhythmia in the heart. So when we are out of rhythm, then we have many problems. In fact, if you want to understand disease in a very simple language, disease is when some part of me is out of rhythm, and the treatment is to bring it back into rhythm. But if we want to prevent diseases, we must maintain the rhythm. We must always follow some routine in our life that will keep all our organs, all the systems, each and every cell, and our mind and our soul in a perfect rhythm.
And could you talk a little bit about how the history of this daily routine, is it something that you made up yourself, or is this something that comes out of the Ayurvedic wisdom, or many,
Yeah, I mean, the daily routine is a very prominent part of Ayurvedic system. In Ayurveda, they explain very nicely how we should have a daily routine. But I have created, based on daily routine, I have created a program which is most suitable in the modern times, because in the modern times people don't have that much time. People are quite busy, so we can't tell them to do many things now as are described in Ayurveda, but we have to take the essence of that and create a program which is suitable for modern lifestyle or modern age. For example, in the Ayurvedic textbooks, they have written some things which were more applicable in those years, thousands of years ago. Now we have changed. Our lifestyle has changed. Our environment has changed. So I have taken that as a base and then created some program, which also I have also understood after traveling all over the world. I have seen different kind of cultures. I have seen different kind of patients. I have seen people, and I try to understand what is their problem, and I make this very simple program which anybody can practice, even a 95-year-old or a 5-year-old, and it's quite effective. I have seen that people are practicing this program, and within 3-4 weeks they do feel some improvement in their well-being.
Okay, that's all I have for today. Thank you very much.
Thank you. Namaste.
Namaste.